You're watching Capital Connection from the Illinois State Capitol.
The coronavirus continues to have a massive impact on industries across the country. One of the biggest ones, of course, is the medical industry. Joining us now is Cyrus Winnett from the Illinois Primary Healthcare Association. Cyrus, it's good to have you with us. I know you represent several of these community health centers that are scattered across the state, hundreds of them that serve people in underserved communities. A lot of times these are Medicaid patients, sometimes patients who don't even have health insurance. There's a lot going on here that your organization has done to adapt.
IPHCA represents community health centers. We are primary care providers that serve underserved communities throughout the state. Like you said, anyone who needs care, regardless of their insurance status, come into community health center and get care. And what we went to the General Assembly with was, you need to look at the effect that that COVID-19 has had on our industry. Because with drops in patient volume, patients coming through the door has resulted in lost revenue for our member agencies. And we're talking about nonprofits that already run on thin margins. When they start to see drops in revenue, it has a detrimental impact on their ability to provide services. And what we were seeing true in Illinois, as it is true across the country, is the disproportionate impact that COVID-19 has had on underserved communities, especially communities of color. And while this may have come to a surprise from some, we have known for a long time that there are deep-seated racial inequities in our healthcare system. And when you have community health centers that are the primary point of care for those communities, looking at diminished service capacity right now, it inhibits their ability to fight back against COVID-19. And in the long term, it could have the effect of even further diminished service capacity, because if you have to lay off staff, you have to close clinics, that you don't know when you're going to be able to bring those staff back.
There was an example in Jacksonville not long ago where there was a community health center that I believe felt pressure to close its doors because they just had so few patients coming in. The patients themselves were worried, if I go see a doctor, I might be exposed to the coronavirus, and therefore I have to be careful. They weren't going, people weren't showing up, and the community health center there felt pressure to close its doors because they weren't seeing any patients, they weren't getting paid, and they couldn't pay their payroll there. How common or how frequent, I think that was back in April, early April perhaps, did you see any more of that around the state? How common was that?
It wasn't overly prevalent, I wouldn't say that, but that center certainly was not unique. We had health centers across the state making difficult choices because while social distancing protocols and while the cancellation of all non-emergent healthcare services and non-emergent dental services, for that particular agency, dental is a big deal. Well, it's absolutely the right call for what needs to be done while we're dealing with COVID-19. It had that effect on agency budgets. It had effect on that revenue coming in the door. And some health centers have been put in a tough decision on how to consolidate resources, how to put what's left available to them where it's needed the most. And many of them have tried to, or have successfully changed their service delivery models. There's, thanks to Governor Pritzker and actions at the federal level, they really opened up the door to telehealth services, which has been a big savior for us and so many other providers too, not just in being able to keep serving patients, but keeping those patients healthy, keeping them out of emergency rooms, out of the hospitals where the availability of hospital beds is so essentially important right now. So the combination of telehealth and just taking stock of what the community needs are right now and support that we've been receiving from the federal and state government have helped keep our industry intact, keep us afloat.
Yeah, so you're plugging people into their doctor there so they don't have to always make that trip in person, which of course right now people are primarily interested in. But there's also, so the federal government, Congress said we're going to give these community health centers some stability, some funding. That showed up early on. Then the state just passed its budget and put some more funding in there for community health centers as well. But how have community health centers had to change how they do their work as it relates to the coronavirus? Because I understand several of these different community health centers are no longer just seeing patients as they walk in, but also setting up COVID-19 test sites, either on the parking lot or indoors. They're trying to collect these swabs and samples, and they're sort of changing what it is they do.
Yeah, Yeah, so, one of the biggest roles that we play, which is a critical role in the fight against COVID-19, is testing. It has been a priority of this administration, our state lawmakers. It's been a priority of everybody in this fight right now is to ramp up testing. And so our health centers have stepped up to meet that challenge. We have now about 130 sites across the state that in total so far have tested well over 150,000 people. And they continue to test thousands of people every day. And we will continue to do so for as long as the need is there. So in addition to changing our service delivery model around telehealth, stepping up and doing testing, I think, has been one of the most significant ways in which community health centers have really risen to the challenge presented by COVID-19 and tried to help us fight back against this pandemic.
Will the community health centers have any role to play in contact tracing or just the testing side?
Yeah, it's a very good question, too. Still learning more about what we can do with contact tracing. It's my understanding contact tracing will primarily be led by local health departments, which we work very closely with. Several of our members are actually community or local health departments as well. They would lead up the efforts, and whatever we can do, we are primary points of contact with patients, people in the community, people who have tested positive. So whatever we can do to help with contact tracing, we're more than willing to help and step up and meet that demand as well. The city of Chicago recently has announced an effort on their part too, specifically, and one of our member organizations in the city of Chicago is one of the lead agencies on that. So yeah, contact tracing, we look forward to doing whatever we can to help with the contact tracing efforts, because now that we're hopefully on the downward slope of this pandemic, contact tracing is a new essential component of what's required for COVID-19.
All of those patients who normally would have been sitting in waiting rooms getting their regular checkups or asking the doctor, hey, I'm not feeling right in this way or in that, put those visits off for months in some cases. Where do those patients go as the backlog builds up of potentially sick people who now have to come back to the doctor for the first time? What kind of a challenge does that present, not just to the organization of these community health centers, how they're going to manage all that, but to the actual health of the patients themselves?
Well, it's a very good question. And I think there's a combination of different things that need to be taken into account. First of all, the ability or the extent to which we continue to use telehealth, and to the extent of which those telehealth services, as they are now, continue to exist, to provide services via telehealth when it's appropriate. And then when you bring individuals into the health clinic, making sure that you have the correct protocols in place to keep people healthy, maintain social distancing procedures, make sure that staff at the community health centers have the appropriate personal protection equipment and that patients have masks and other things, so we can be keeping one another as safe and healthy as possible when we're bringing people back in. And you raise a very good point about capacity moving forward, and it's something I'd like to address. We have been talking for many years about the inequities within our healthcare system, and that's one of the things that IPHCA was coming to the legislature with prior to COVID and saying there needs to be a greater investment in community health centers that serve underserved communities, especially communities of color. And what we saw from the state legislature this past session was an investment to protect that system from the problems that have arisen from COVID-19, but they also made an investment into our rates of reimbursement, a long-term investment for further propping up this industry. And I really want to just take a moment to recognize and thank every member of the Black and Latino caucus in the state legislature. They came to Springfield seeing one of the most difficult budget propositions they've ever seen, but they did so recognizing that what their communities need the most right now is healthcare. And they went to bat for those communities, and they went to bat for community health centers. And the result of that was a tremendous step forward in greater investments over time to fix the inequities within our healthcare system and protecting their communities right now from all of the problems that COVID-19 has presented.
All right, well, Cyrus Winnett from the Illinois Primary Healthcare Association. I hope you stay healthy as you and your organization works to keep so many others in our state healthy as well. Thanks for joining us.
Thank you so much, Mark. Really appreciate you having us on and taking the time to talk to me today.
All right, we're back in just a moment.